Hello, I'm Dr. Maria Cilindro. I'm practicing integrative medicine in Pasadena, California. Today, the topic is very interesting because for many of you, you might not have encountered this therapy. And I have my professor, my teacher, who is as my guest speaker. It is an honor to have you, Dr. Rowen. Hello.
Thank you. Well, I'm honored that you would have me, Dr. Maria.
Thank you very much. I know you're very busy, and as a host, basically, I would like to introduce Dr. Robert Rowen. However, he has a very unique background, and I would rather have him introduce himself because he is like the father of oxidative medicine specialty. Can I have you introduce your background, Dr. Owen, maybe for 2 to 3 minutes, okay?
Sure. Well, this is important for people to have some trust in who they're listening to. I had a conventional college education at Johns Hopkins University, where I graduated Phi Beta Kappa with a Bachelor of Arts. I did my medical school at University of California, San Francisco. I went on and did a family practice residency at the University of Arizona. And subsequently, I migrated to Alaska. There, I accumulated enough hours in the emergency room to sit and pass the board exam for emergency medicine. And I also passed the board exam for family practice. So at the time, I was doubly board certified in standard Western medicine. But my interest grew away from that because I did not care for polluting people with chemicals, drugs, cut, slash, burn, and poison, we call it. And I looked to other ways to help the body heal. And that led me into what we now call integrative functional biologic medicine.
Yes. Mm-hmm. Very good. And Dr. Rowen actually did travel to Sierra Leone. You want to tell them a little bit about that in 2014? Remember? That was an amazing one.
Well, I have been doing ozone therapy since 1986, longer than any person alive in North America. And in 2014, when Ebola was ravaging West Africa, I knew that we had a treatment for it. I just knew it. And I decided I would go. And a set of circumstances came up where we had a host in Sierra Leone. I recruited Dr. Robbins, who you're going to have on soon, to come with me. At first, he said, "No way, I'm not going there and getting Ebola and dying." And I said, "Fine, I'll go myself. I'm just going to do the direct intravenous method." And he thought about it for a whole another 10 seconds. And he said, "No way, Rowen, I'm not letting you go and get all the credit. I'm going to come too." So that's how we both went. And that's a long and brutal story, Sierra Leone. We did train a number of doctors. We were shut down because of pharma interests, but we managed to get to 5 cases of Ebola, and all of them, 100% survived. No one has a record like that with this disease. And I published it.
Yes, you did. And you published several other reports also.
Yes.
Yes. Now, I really have to admit that I learned a lot from Dr. Robert Rowen in oxidative medicine and integrative medicine, and especially the training for ozone and hyperbaric ozone. I went to his place where he is currently practicing with his beloved physician wife, Dr. Terry Shu. I love them both, yes. And they are in Santa Rosa, California. Sometimes when I have a patient nearby there, I told them, "He's my teacher, go and look for him." Yes. Okay, so Dr. Owen, since we are going to talk about hyperbaric ozone, my first question is, what is ozone therapy? Because this is for community awareness. So my question is, maybe you can explain in your own way, ozone therapy and how many kinds of these therapy systems are there?
Well, first we have to ask, what is ozone? And ozone is O3. We're breathing right out here in the air, you're breathing oxygen gas, which is O2. And ozone, if you smell the air after a thunderstorm, it smells sweet because lightning stimulates the creation of O3 from O2. The O2 splits apart, and one oxygen now collides into another molecule of O2, and now you have O3. It's unstable, doesn't last very long. It's very, very reactive, and it cleanses the atmosphere. Well, as luck would have it, it also cleanses us, and it creates a wide variety of beneficial effects in our body. It's nature's most powerful, naturally occurring oxidant. And the term oxidant means grabber of electrons. So ozone wants to grab electrons and strip them away from something else. And that creates havoc for bacteria because bacteria are very sensitive to oxidation, so are viruses. In fact, our immune system generates all kinds of oxidants. Bleach is an oxidant. Our immune system creates all kinds of pro-oxidants to destroy invaders and pathogens. And that's one of the effects of ozone, is simply by oxidizing, by stripping electrons off of bacteria and viruses, you render them inactive or you destroy them. That's just one of its mechanisms.
Thank you. Thank you. Many people heard about hyperbaric oxygen, but they don't know about hyperbaric ozone. How is it different?
In hyperbaric oxygen, your whole body goes into a chamber. So your whole body is in a cylinder or a tough bag, and your body gets pressurized with oxygen or even compressed air. And that increases the amount of oxygen in your body through the circulation. Ozone therapy, the more common form of it, is where you stick a needle in the vein and then blood goes up. Pretend this is in a bottle. So the blood goes up into the bottle under vacuum, or it can go into a bag and ozone is added, it gets mixed up, and then the blood goes back in. Now, if it's done under gravity, that's called gravity ozone. A better form of ozone is to do it under pressure. So you use a glass bottle, and glass, in my opinion, is much better than plastic. And the vacuum in the bottle sucks blood up to say here, let's just pretend it's here. And then ozone gas is generated by a machine, and then it is pumped into the bottle under pressure, and it's swirled up. So you get a great mix of the gas and the blood turns red, and the ozone reacts with it. And then under pressure, the blood goes back down into the body. That's hyperbaric ozone therapy. Your body is not pressurized, just the bottle is pressurized.
Okay. All right. Now that's the difference between hyperbaric oxygen, which is you go in the tank usually, and here you sit down and we infuse the blood that is mixed with the ozone, re-dripped to the body. Now, what is the difference between this hyperbaric ozone with other than ozone therapy that we heard? Let's say rectal ozone or
with other types.
Yes,
okay.
Other type, yeah.
Where ozone can be administered anywhere in the body except one place, the lungs. The lungs are very intolerant of ozone, and if you breathe it, it'll make you cough, gag, very irritating. But ozone can be given rectally. That's called insufflation. Vaginally for women, that's called vaginal insufflation. It can be given in the ear. That's called ear insufflation. You can bubble ozone through water and ozonate the water and then drink it. And now you've done ozone water. I have given ozone in the bladder. I have given ozone through a tube down into the stomach. Ozone can be put in the mouth. It can be injected in the muscle, subcutaneously, into the joints. In fact, it can be put anywhere. It's oxygen. It just can't be inhaled.
Okay. All right.
The hyperbaric form of ozone that I told you, like pressurizing this bottle, in my opinion, is the most advanced and most effective form of ozone. I had long discussions with Howard Robbins and friendly fights with him as colleagues, as he was telling me that his method is the best method that there ever was and ever will be. And I told him, no, I got something better. And he refused to admit it until he actually saw it. And he said, now I see the difference. You're not doing MAH, major autohemotherapy, because that's done under gravity. You're doing hyperbaric. And when you pressurize the gas in the bottle, you get, in our opinion, my opinion, having done this for like 25, 30, for 30 years, the results are unbelievable. The results that we get. We have Lyme people waking up on the chair. I have COVID patients getting better on the chair before they leave the office. They're almost normal. Many of them, not all. There's a lot of failures because we see a lot of people, but the results are far, far more favorable than not favorable. Far more. I'd say 80% favorable at least. And there's nothing like that in conventional medicine, especially something that has no toxicity and doesn't leave a toxic residue. The only residue ozone leaves is oxygen, which is the most important part of life.
Yes, correct. Now, okay. Dr. Rowen, you did mention a little bit about some of the benefit for the ozone in earlier questions. Can we tell the audience what can ozone therapy do for our health in general?
Well, let's look at its mechanism. One, it knocks out invaders by oxidizing them. But let's look at its effect on circulation. What's the most important thing for life in one word? It's oxygen. I mean, you go without oxygen for 3 minutes and you're dead. Oxygen is the most important thing for life. Ozone stimulates the red cells to release more oxygen. What good is a freight train carrying cargo if it doesn't release its cargo where it needs to be released? Ozone helps to stimulate that release. Ozone improves red cell flexibility so that the red cells can get through capillaries, which are actually a smaller diameter. So here you have a red cell, which is bigger than the capillary, and it can't get through. What ozone does is it helps the red cell squeeze to get through and deliver its oxygen cargo. So it improves red cell rheology, blood flow rheology, that's flow. It seems to have an improvement in mitochondria, the energy furnaces of the cell, because when you give ozone, this difference, this is called the arterial venous oxygen difference. Now, if this was the difference, then you're not releasing any oxygen. And the person's going to die, even if there's plenty of oxygen, because the vein should be down here. And the difference is what is burned. The more oxygen that's burned in here, the healthier you are. Ozone seems to improve this. Very important. You're actually burning more oxygen, so you're making more energy. Ozone stimulates the immune system. That's known. It modulates the immune system. So if your immune system is like this, it brings it into balance. If it's like this, it brings it back into balance. Those are the major effects of ozone.
Yes.
And by doing all of that, I believe a person can stay younger, healthier, in better health. And in my opinion, ozone is the ultimate age reducer, the ultimate longevity treatment, because it induces something called superoxide dismutase. Ozone, even though it's an oxidant, stimulates antioxidants in the body through what's called NRF pathway, nuclear it's a nuclear factor pathway. And when you ozonate, enzymes are modulated up, including SOD, catalase, glutathione peroxidase, and all of these would add to longevity, especially superoxide dismutase.
Mhm.
So I take ozone, hyperbaric ozone myself on a regular basis every few weeks.
Excellent. Yes, I'm following behind you. So now many people are afraid because the word of hyperbaric, and also they're afraid because of the blood. How ozone treatment is it very safe for human treatment?
It's extremely safe. I teach doctors from all over the world, and I was asked to present at a major ozone conference on the safety of hyperbaric ozone. So I surveyed my trainees, and we probably found a minimum of 29, maybe 30,000 hyperbaric ozone treatments, including high dose ozone treatments, which is called 10 pass, where the blood goes up and down 10 times.
Mhm.
It's a lot of ozone. Unbelievably safe.
Safe, very safe. So what kind of complication can happen when one has a hyperbaric ozone treatment?
If you have somebody who doesn't insert the vein right, the vein here, the high pressure can cause a lot of blood to pool in the arm. And that's not comfortable, but that can happen. The way we do it, it doesn't happen to us because we only use plastic catheters. But if you go to a doctor who doesn't do that and uses metal, you can get a big blood blister. Anybody can be allergic to anything. We use heparin. Somebody could be allergic to heparin. Rarely somebody could be allergic to ozone. I haven't seen anything serious, maybe some rashes, that's all. It's extraordinarily safe. It's probably safer than you going to the store and buying Tylenol at the pharmacy and taking it. I believe it's much safer than that, many-fold safer.
Yeah, you teach us how to prepare patients before they come with the balloon and all those. What kind of other preparation patients should have before they have to have an ozone treatment?
Well, you don't really have to have a lot of preparation. We give supplements that dissolve clots if we're going to do high dose ozone, because their blood's going to be out of the body for some time. In this bottle, remember, we're pretending this is a glass bottle. It's not, it's just a vitamin pill bottle that I have. But when blood is in glass, it can tend to clot, and we want to give enzymes to try to keep it from clotting. And we give some other things too. But I've taken people right off the street who've had no preparation, and I do ozone, including high dose 10 pass on them. And it's very rare to have a problem.
Yes, thank you. Can ozone kills microorganisms such as, I think you mentioned a couple, well, Ebola is virus. How about bacteria, parasite, fungus, anaerobic? Cancer cells seems to be anaerobic. So can the ozone be used to kill those?
Well, let's go through them one at a time.
Yes.
The main thing that ozone does, I believe, is it stimulates and modulates the immune system. So I'm not going to sit here and say ozone's going to kill all the Lyme bacteria in your body, or it's going to kill all the viruses in your body. I believe that ozone is upregulating the immune system and empowering the immune system that God made to go and do what God designed it to do. We're not living like we used to live 100 years or 150 years ago. We have a very polluted world, and our nutrition is hopelessly deficient. And I said hopeless, because unless the individual wakes up, nothing better is going to happen. It ain't going to happen from government and industry, because government's bought out by industry. So ozone just upregulates the immune system to supercharge it, to get it to do what it's supposed to do. Now, if you give ozone locally, let's say you have a local infection, and I've done this. I had a guy, I'm trying to get my leg up, but pretend this is my thigh,
Mhm.
and he had a tick bite, cellulitis on his thigh. And you can give ozone locally by injection in there, or you can give it intravenously in high dose. And he got all better. I published the case. I have a woman, and I published her case where she had gotten 2 artificial hips, right and left side. And a few months after it was done, the right side got infected. This is an infected prosthetic hip. It's a calamity. It is
Mm.
one of the worst things that can happen in medicine because it's basically untreatable. They typically have to do surgery to debride it, to get the infection off. And in her case, they told her she was going to have the prosthesis removed. And then she would be left with a flail leg flopping in the breeze and getting antibiotics inserted into the joint space and intravenously. And she came to me looking for something else. I shot up the joint with ozone. I gave her intravenous ozone. I sent her back to one of my colleagues who I trained in Southern California, and she continued therapy, but I also found that she had an infection in her mouth. Now, no one would look for that. And the infection happened to be in canines, eye teeth.
Mhm.
And in Chinese medicine, actually German medicine, the eye teeth are connected to the liver meridian, which controls the hip. Well, as it turned out, when they finally were able to get a culture of her hip, she had oral organisms, bacteria in her
Mm.
hip joint. Wow. In
Wow.
any event, they gave her a simple, cheap antibiotic, amoxicillin, and she continued ozone sessions, and they told her she had to get her hip redone surgically. She didn't do it, and between oral antibiotics and the ozone therapy, her infection cleared. It's the first ever in world history of this type of infection clearing without surgery or intravenous antibiotics.
It's amazing.
I published it.
Yes. Oh, good. Yes. Amazing. Yeah. Thank you for that explanation. Now, since this is so safe that I also agree, if I have to choose any of the machine I invested in my office, I think the ozone machine should be the one that I keep, right? If only one can I
That's
keep.
what I say. If you're going to just keep, if you're going to have, if a doctor is only going to have one machine in his office, the most valuable machine to have is the ozone machine.
Oh, I feel that way too. Yes, yes.
Just about anything. Incidentally, I'm going to share another case with you that I haven't published yet, but I might. A guy who believes in making himself look young was injecting high hyaluronic acid filler into his skin.
Yes.
Well, he happened to do it right here, right in floppy skin here. He was trying to, artificially make himself look younger. The next day, his hand turns black. He accidentally shot the filler into his brachial artery, and it came down and cut off the circulation to his hand.
Wow.
And I didn't see any hope for him, actually. I didn't think he had a chance. We started doing ozone intravenously. I gave him a bunch of supplements, including lumbrokinase, among other things. And then I finally resorted to injecting his radial artery with ozone.
Mm-hmm.
And he saved his hand.
Wow. Direct injection.
Into the artery.
Oh, wow.
That's how safe this is.
Yes, yes, yes. Well, I'm glad we mentioned this. So whoever listening this one will also tell other people, because many of them are still not sure what is ozone, right? So
it's oxygen.
Yeah.
It's active oxygen.
That lives longer. Okay. Now,
and if they want, they could just go to pubmed.com, PUBMED, pubmed.com, and type in my name, Rowen, and ozone. And it will take you to many articles that I published. If you do it on Google, it will take you to the article that I published on Ebola.
Yes, yes. Thank you. since we talk so good about this ozone therapy, why some states, including California, do not allow people to sell or buy the ozone generator?
That's for air use, not for medical use. It's because ozone is an environmental pollutant. It's not meant to be breathed. And they're concerned about ozone air purifiers. Now, I don't have a concern about it. I work around ozone all the time, and I breathe in a little bit. If ozone is in the room at the perfect concentration, which is low concentration, the air smells sweet, like after a thunderstorm. But if the ozone is at too high a concentration, then it smells pungent, and that's what you don't want. So California figures that its people are too dumb and stupid to think for themselves. So they ban it, just like they think that the population is too dumb and stupid to make a choice on vaccinations for themselves. So they forcibly vaccinate school children. That's because we live in a state that believes it knows better for you than you know for yourself.
Yes, yes, yes. Okay. All right. Okay, very good. Because I also have met this lady who is the owner of a company who does ozonize the home to kill, like, let's say, fungal infection.
It's a good idea. You mentioned about fungus.
Yes.
You can treat fungus with ozone. I've treated candida problems, vaginal candida problems. If somebody had a system-wide fungal infection, ozone probably would help. Ozone is probably more limited when it comes to fungus. Fungus is a much more sophisticated bad guy.
Mm-hmm.
And you asked me about parasites. There are a few parasites ozone will probably treat, and that would be amoeba and maybe babesia, which is amoeba-like, and probably malaria. But the more sophisticated parasites like worms, probably not.
Ivermectin.
Yeah.
Yes. Okay. Yeah, Nobel Prize winner. Okay, now let's go with this hyperbaric ozone therapy. It's not easy to find. Let's say I have even now I have a patient who would like to have like a chelation therapy or hyperbaric ozone therapy because he suddenly was found to have a heart attack and he was very young. So how to find this good doctor who provide hyperbaric ozone therapy? I know you have the company.
I'm biased. I want people to go to the people I've trained because I think they're the best. So we have a list at our office website. Our office website is Dr. Rowen, DRSU, Sue, Dr. Rowen, DrSue.com.
Mm-hmm.
And we have a list of trainees on that site, and you're probably on that list because we've trained you. And we get thousands of hits a year from people looking for people we've trained.
Yeah, I forgot about that website. Okay, thank you for reminding, and excellent information today. Anything else you want to say about hyperbaric ozone, Dr. Rowen? If not, why don't we do a take-home message? It's 30 minutes.
Hyperbaric ozone is probably the more sophisticated form of ozone, and it has to be administered through blood. So you have to go to a physician for that. And if you're sick, it's worth it. It's just worth it. But you can do home ozone. And our website, drrowen.drsue.com, has a lot of information on home ozone and machines you can get, packages, discounts. And this is something I strongly suggest my patients to do this at home. When COVID first came out, Terry, my wife, and I put a lot of effort into training people, and we made a video, and that video is up at ozonewithoutborders.ngo. For a $20 donation, you get to see our demonstration of all the home ozone techniques. I don't get the money, the nonprofit does. But the blood ozone is for sick people. Now, I like my patients to do home ozone, and I encourage them to get machines at home for purifying water, for doing rectal insufflation, for making ozone water, vaginal, ear, and rectal. Those are the things that you can do at home with this. You can even get an ozone body bag and get into a body bag. Some of the companies make this and fill up the bag with ozone, and it gets absorbed through your skin.
Mhm. And you also have an equipment in your office for the spa, right? The ozone spa.
We do. We have
Yeah.
something called a Hockett, H-O-C-A-T-T sauna. It's a spa that puts ozone and it gets absorbed into your skin. It's a really good treatment. It's probably as good as a single pass hyperbaric ozone.
Yes, yes. Well, thank you so much. And I really appreciate your presence here with me in the 30 minutes information about hyperbaric ozone. I'd like to tell everyone here who listened to this video that Dr. Robert Rowen and Dr. Terry Shu both are practicing in their private office in Santa Rosa on Country Center Drive, and this is in California. Thank you so much. Would you like to also announce your phone number, or they can easily find it?
They can find it on the website, but the phone number is 707-578-7787. And we do phone consults for people. You don't have to come in, and I can give you a good idea if ozone might be a good choice for you. And I don't try to solicit patients on the phone consult. I just try to educate.
Yes. Thank you so much, Dr. Rowen. I really appreciate your time today, and see you next time.